Okay, so today we're beginning research methods. So we're going to just do like a recap. I know you guys have covered this last year. This PowerPoint is kind of updated compared to last year's one, so it's got a few more slides in it. Yeah, and I've just removed some slides like p-values and things because they're no longer assessed. But yeah, so basically what we're going to do today is just try to cover the first few topics of research methods. Also, when I was modifying this PowerPoint, I kind of tried to put everything in order. Because last year I remember like samples would be the third slide in the PowerPoint, but then samples would be way into the middle of the chapter in the book. So now I've tried to like make sure that the topics in the PowerPoint correspond to the positions of the topics in the textbook. So you can do your learning activities like in a nice sequence or something. Anyway, so that's basically what we're doing today. So before we start, I know a lot of you do have this negative attitude towards research methods. It is a little bit like drier. It's not as fun. It's not as interesting as the other topics. But when we're going through it today and when we're going through it on Friday and next week, because these 2 weeks are for research methods, we will try to think of different examples. We'll try to go through different scenarios to try to make it interesting and if possible, fun. So these are some tips for you guys to just basically think about how you can make your revision of research methods fun. Because for a lot of you, this shouldn't be like a new topic. Research methods, what we're doing today and what we're doing this week and next week is just like revision, okay? It's just a recap. It will be detailed, but again, you shouldn't be feeling like, oh my God, I'm learning something completely new. So one thing you can do is you can make concept maps. So you can get like colored paper or like poster paper, and you can kind of like make a concept map for like, you know, the progress of conducting a research study. And you can write, okay, first the researcher gets a sample, then you can draw an arrow and write, okay, the sample has to be from the population. And, you know, you can make like a nice little concept map and connect different topics together, because all the topics in research methods tie into the same thing, and that is conducting a successful research study. The second point there is that you can watch YouTube clips. There's so many YouTube clips for certain topics. So whether you look at any psychology course in any year 11 and 12 level around the world, you will find something about research methods. Okay, and there's a lot of good ones on YouTube. I've also posted some kind of cartoonish kind of animated ones on the week 5 tile. So you can also have a look at those. I think they explain it in a kind of less overwhelming way. Okay, I'm hoping, yeah, okay. Also, when we've got, also in terms of application of skills, we obviously are going to do a lot of practice questions, especially next week. We are going to do a quiz at the end of this week on Friday, kind of just based on the main topics, I guess, not like every single topic, but the main ones. So that's going to be like a multiple choice question type quiz. And basically, if you ever have any questions, you can ask me for help. And just when it comes to research methods, just give it a little bit of like positivity and optimism, because I know it's like a dry topic, but sometimes when you have like a lazy attitude towards it, it can make it worse. So just try to think of it as it's not that bad, to be honest. And it's like, if you just give it a bit of like attention and a bit of effort, it will kind of like, be okay. It won't be that bad. Yeah. All right. So just to confirm, everyone can hear me, yes?
Yep. Yes.
Yep, miss.
I thought no one could hear me for a second. Okay, cool. So that's basically a little intro. Now, before you get a heart attack, this is the chapter 1 research methods questions checklist. The questions have been selected, even the ones that say all questions. Actually, there's only probably 2 or 3 questions in that entire learning activity for you to do. So these are your learning activities which you have to complete. Now, I want you to just go through these as we go through the slides. So as we finish the slides, just quickly finish these off. Don't let them pile up. I've chosen the learning activities that I think are most relevant in terms of a SAC and exam type perspective, not the ones that are kind of irrelevant or unnecessary for us to do. Okay, so make sure you do keep ahead. Depending on which textbook you have, you will do the learning activities accordingly. So if you've got the old textbook, it's the green, it'll be 1.2. So 1.2 is 1.3 in the new textbook. Okay, so that's how you're going to read this entire migraine that I've created. Okay, so that's basically chapter 1 research methods questions checklist. Now, I want you guys to submit these questions by Sunday. So that gives you a little bit more time compared to submitting it on Friday. Okay, try your best because again, it's good revision. Okay, so now let's start. So the first topics that we kind of go through, or, you know, when we're conducting a research study, the first thing that we have to do is we have to look at who are my participants going to be. And we have to remember that the participants that are going to be in your study are also known as the sample, okay? Sample, when I say, oh, wow, your study has a really big sample, what I'm really saying is that, oh, wow, your study has a lot of people in it, okay? When I say, hey, your study has a gender imbalance in the sample, what I'm really saying in simple terms is that, hey, your study has a few more females than males in it in terms of participants. So whenever we're talking about a sample, we're talking about the actual participants that have ended up being in the study. They're the ones that are being involved. They're the ones that are doing the activities or tasks the researcher wants them to do. Okay, they're the actual people in the study. Now, when we talk about the sample, we talk about the sample as being kind of within the population or a subset of the population. So if you look at these two diagrams here, the population is the big orange triangle and the sample is situated within the population, okay? So we don't just take samples out of nowhere, we take samples from a population, okay? There's always a bigger population from which we are drawing the sample. So if you've got all these ants here, about 9 of those ants we take out of that population and they become our sample. And why we do this is that if we do get really good, accurate results that are reliable, that are valid, that are something that we could potentially generalize, then we will be able to successfully generalize the results of the sample and say that these same findings could be seen in the population because the sample was from the population to begin with, okay? They're supposed to be representative of that population. So basically what this could mean is that if I take all the psychology students in Miss B's class and in our class, and I say, okay, I want to conduct a study on the effect of memory tips on psychology exam performance. And I get maybe like 5 of you from our class, 5 of Miss B's kids, and I teach you guys a lot of memory tips and then I make you do an exam. Whatever findings I get from that exam, so whether the memory tips were effective for you in exam performance, whether they were not effective, I can then make a broader generalization to that population and say that because the kids in my class and Miss B's class did better on the exam when they were taught memory tips in advance, I can then say that the rest of the entire psychology cohort at Altaqua College will also do well in the exam if they are also taught memory tips in advance. Okay, so that's what we mean when we say the sample has to be representative of the population, because whatever results I get from the sample, I need to be able to then broaden or generalize back to the population. Okay, so that was just some example for you there, which I just talked about. So another example is if we're looking at university students, a sample could be first-year university students. Okay, so it's just kind of a subset of the population, basically. Okay, then we look at research hypothesis. So a research hypothesis is simply a testable prediction. It's basically a prediction or something that you hypothesize is going to happen in a study, okay? And usually a research hypothesis will contain an IV, a population, operationalized variables, which means that you're talking about how the variables are going to be measured, as well as a DV. So these are the 4 main things that every research hypothesis will always include. And you guys have written quite a few research hypotheses last year, so you should be familiar with how it looks like, but we will go through it again as well. A research hypothesis is important because it gives our study direction. Okay, if I'm a researcher and I want to, for example, study the impact of daily meditation on reduction of migraines, I need to have that direction. I should be able to say it is hypothesized that daily meditation will reduce the severity of migraines. That's giving me a specific direction. If I'm just a researcher and I'm like, hey, you know what, like my study is just about like meditation and migraines, that doesn't give me detail. It doesn't tell me what about the meditation, what about the migraine, what am I actually studying, what is the effect or the direction of effect there. So that's why it's important for a research hypothesis to always be worded very clearly and to always show a direction of effect. Okay, is it increased meditation or is it decreased meditation that's going to lead to less migraines, essentially? Okay, now an experimental, a research hypothesis only ever works with experiments. You can't do a research hypothesis for a case study. And the reason for that is that in a research hypothesis, we are always measuring the effect of the IV on the DV. Okay, there has to be a cause-effect relationship in order for us to be able to write a research hypothesis. I can't write a research hypothesis for like an observational study unless that observational study is part of an actual experiment. Okay, so we have to make sure that we remember that research hypotheses can only be written for experiments because we need the IV, the cause, and we need the DV, which is the effect. Then we look at experimental research. So this is the basic question of what is an experiment? Why is experimental research or experimental method
Sorry,
important?
Miss.
Yeah?
Can you go back?
Yeah. Oh, sorry. This one?
Yeah, you know, when we were talking about the population, we're talking about the whole population, not the number, right?
Yeah, the whole population. So I wouldn't write 10 students from psychology classes in Altaqua. I would write psychology students at Altaqua. So I wouldn't mention the actual number of participants there. Okay?
Yeah, and if we do, we lose marks, right?
Exactly. You wouldn't get the marks for mentioning the population there.
No, not
So
the
it's always the
sample.
population. Yeah.
Okay, yeah, makes sense.
Experimental research is basically looking at how we use the experimental method to investigate research questions. So again, we're looking at the cause and the effect. Experiments are basically investigating cause-effect relationships. So the cause is usually the IV and the effect is usually the DV, okay? Another word for results or the effect of the experiment is the DV. So an experiment obviously assesses cause-effect relationships between variables, so usually the IV and DV, under controlled conditions. Controlled conditions means that you are usually running an experiment in a setting where you as the researcher can control, or you as the researcher have some kind of ability to manipulate. So what that means is a researcher will usually run their experiment in like a lab. They might run it in, a classroom, somewhere where the conditions can be controlled and where there's not much potential for the experiment to go haywire, basically. Now, the basic idea, like I said before, underpinning all experiments is that when I manipulate or when I make a change or when I try to modify the IV, that will always cause some change in the DV, okay? So obviously, if we're going to do an experiment on, sleep deprivation, so being sleep deprived and that the effect of that on academic performance, we could say that the IV would be being sleep deprived and the DV would be academic performance. So the IV is being sleep deprived. And if I ask the experiment to say, okay, participants, I want you to be sleep deprived for 1 hour. And on the third day of the experiment, I'm like, okay, today I want you to be sleep deprived for 4 hours. Then I want you to be sleep deprived for 6 hours. Okay, I can manipulate the IV. In other words, I can manipulate or modify the amount of sleep deprivation that my participants are going to go through. And each time I increase the hours of sleep deprivation, I will see almost an immediate consequence on the DV, which means that participants who have sleep deprivation for 6 hours will usually show worse academic performance than the participant who just was sleep deprived for 1 hour. Okay, so again, this is kind of showing us that when we manipulate our IV, it will produce a change in the DV. Okay, if we look at this middle picture here, it's talking about the effect of the independent variable on the dependent variable. So obviously in this study, I think they were assessing the effect of caffeine on the number of words recalled. So we know Coca-Cola has caffeine, so that's why participants in the experimental group would have it. If you remember from last year, people in the control group don't have the IV. They're not exposed to the IV. 7-Up is like lemonade. It's like Sprite. It's like just a lemon drink, so it doesn't have caffeine in it. So obviously that would be the control group. So anyway, what we do is we can manipulate the IV. So I can decide to give my participants 1 can of Coke. I can decide to give them a liter of Coke. I can decide to make them drink Coke just once a week, or maybe every day, or maybe 3 times a day. So when I'm manipulating that independent variable, every time I do that, I do have an effect on the participant's ability to recall the number of words. It is possible, because caffeine is a stimulant and it does make you more alert, that when participants have 500 milliliters of Coke, they might recall more words as compared to just having like 100 milliliters of Coke. Okay, so every time I manipulate the IV, it immediately produces a change in the DV. That's the main idea you really need to get from this slide here. Okay, cause always leads to effect. Every time I manipulate the IV as a researcher, I am producing a change in the DV. Okay, so if everyone is all good with this slide, I'm going to move on to the next one, which is basically talking about our variables. So this is the experiment. This is the example that we've been using for all these years with the whole red cordial and hyperactivity. There are other examples we can use, but I just like this one for some reason. Anyway, when we're talking about variables in a study, we have to think about the fact that when I'm conducting an experiment, there are always two variables, right? We've talked about experiments being based on cause-effect relationships. The cause variable of that cause-effect relationship is the IV. It's the variable that we're manipulating in some way to cause some change in the DV. And the dependent variable is the variable that we are measuring for change. In other words, the DV is basically what kind of results are we actually going to get, okay? Because another word for results is DV. The results of the study are essentially our dependent variable. Now, in this study, back in the 90s, people used to think that drinking red cordial would lead to hyperactivity in children. So it's just a hypothesis. So let's say it is hypothesized that children who consume higher amounts of red cordial will show higher amounts of hyperactivity. So obviously, as a researcher, how I'm going to manipulate this IV is I can decide to give my kids, my students 200 mils of cordial or 500 mils of cordial or 1 liter of cordial for that matter, okay? And then I'm going to assess, okay, how hyperactive are they? Because if I give my kids 500 mils of cordial and they're still not jumping up and down and they're still pretty quiet, then I might be like, you know what, maybe my hypothesis is not going to be supported because it doesn't really look like 2 glasses of cordial is really causing them to get hyperactive. Okay, so that's basically what we mean when we say that the variable, the IV, can always be manipulated in some way. We can change the amount, we can change the intensity, we can change the quantity of the IV we're exposing to the participants. Okay, if everyone is all good with IV and DV, we can probably move on to the next slide, which is the operationalizing part. And that's not hard because that's basically what we just talked about, okay? Operationalizing the IV and DV basically means that you are taking that red cordial and you're putting a number to it. You're saying, okay, I'm going to give 500 milliliters of the red cordial to the participants, or I'm going to give 250 mils of red cordial to the participants, okay? In this case, the simple IV without operationalization or without being operationalized is the red cordial by itself. Simply the red cordial without any number attached to it, without any amount attached to it, is the simple IV. When I'm doing a study though, I can't just say, okay, I might just decide how much I want to give them on the day, whatever I feel like, whatever mood I'm in, that's the amount of cordial I'm going to give them. Now, you can't do that. You've got to be specific. In order to make our independent variable specific, okay, so we can put it in our research paper so other researchers can maybe replicate or repeat our study by looking at what we've written. We need to be able to operationalize variables. Operationalizing the IV and DV is simply how are you going to measure the IV and DV? In other words, what amount are you going to specify for a specific IV? Okay, if I'm giving Coca-Cola to see how well participants will recall words, how much Coca-Cola am I actually giving these participants? That's basically operationalizing that IV. Okay, if I'm talking about sleep depriving students and then seeing how their academic performance is affected, how much sleep deprivation am I going to make these participants go through? Is it 1 hour? Is it half an hour? Is it 7 hours? How much? Is it a day? So obviously, when we operationalize the IV and DV, it's simply how we're going to measure the IV and DV. Okay, so this is just an example. So obviously, if you're testing the effect of brain training, which is doing all those like Sudoku, all those like problem-solving puzzles, if we're assessing the effect of brain training on short-term memory for psychology students, a simple IV and simple DV could be brain training and short-term memory, because we assume or we predict that brain training will lead to improvements in short-term memory. Okay, that's the simple IV and DV. You can see there's no numbers attached to them, no amounts, no quantities. It's completely simple and non-operationalized. If we move on now to the next slide though, you'll notice that we have operationalized them. Okay, we don't always need to include numbers, but we have included some detail there. So we've talked about Okay, brain training. How are we going to complete this brain training? This time brain training is going to be through completing maths problems, strategic maths problems. In another study, the brain training could be through completing a word matching task. Okay, so obviously brain training is the same simple IV, but the way we're operationalizing that in 2 studies is different. Okay, in this one, the operationalized DV is short-term memory, and we're measuring the person's short-term memory by how many numbers they can recall correctly. In the second experiment, though, it's still short-term memory, but now we're operationalizing or measuring it differently in terms of how many words are remembered and written down correctly after an interval. So obviously, the same simple IV and DVs are being discussed here, but basically the way we're measuring them or operationalizing them will be different. Okay, so let's move on to the next slide. Okay, I just wanted to note that it is 11:29. I'm not sure if this Zoom is going to go down at 11:30. So if it does, I'm going to go back to the school box and I'm going to post a new link. Okay, so everyone just rejoin from there. Okay, anyway, so we'll just see how we go. Constructing research hypotheses. So obviously, when we construct research hypotheses, we have to make sure that we include those 4 elements, which are our iPod, so independent variable, population, operationalized IV and DV, and our simple DV. Yes, this PowerPoint is on Schoolbox under the week 5 tile. Okay, so basically when we're talking about operationalized variables, again, it's just about including how they're measured. Usually how I do this is I just put the operationalized part in brackets because I just find that kind of separates it and makes it easier to write out. But it's really up to you. You don't have to do it in brackets. You can just do it as a normal sentence. But yeah, that's up to you. Okay, so if we look at like creating a hypothesis for the previous example that we just looked at, we can talk about the fact that it is hypothesized that, okay? It's always good to start with those 4 words. It is hypothesized that. Now we've got to mention our population, which is the green one. So our population in this case is students that undertake 3 and 4 psychology or year 12 psychology. That's our population. Who complete weekly brain training activities, that's our simple IV in red. And how we're operationalizing that, which is the purple, is by saying through completing word matching and recall tasks. What's the effect of that? They're gonna have improved short-term memory, which is our simple DV. And then we're operationalizing that as measured by number of words recalled correctly after an interval. So this information is all from the previous slide. Compared to, this is the important part I want to stress on. Whenever you write a research hypothesis, you must include a mention of the control group. You can't just end the research hypothesis by saying number of words recalled correctly after an interval, full stop. Who are you comparing it to? You can't run an experiment without a control group. Control group are your baseline for comparison, okay? They're what you compare the experimental group's results with, okay, to see if there was a change. So obviously you need to say compared to the students who did not complete this brain training, okay, who were not exposed to the IV. This is our control group. You must make mention of them, okay? So make sure you do make mention of them. Usually structure-wise, most of the time it makes sense to mention them at the end after you've talked about what the effect on the experimental group is going to be about. Okay, any questions about research hypotheses like in general, or any questions about this one on the screen? No?
No.
All good? Okay.
Yeah.
So in that case, we'll just move on. So this is another example looking at the effect of meditation on sleep quality. So obviously when we look at meditation on sleep quality, we're probably going to hypothesize that if you meditate more, your sleep quality is going to be better. So what's your research hypothesis going to then, what's your simple IV and DV going to be? Well, your simple IV is going to be meditation. Your simple DV is going to be sleep quality, because that's what is going to change as a result of the meditation. And we're studying this for year 10 students. So that's our population there. So let's look at how we might operationalize the IV and DV. So remember, in 2 different studies, we can do meditation differently. In one study, we might ask the participants to meditate for half an hour every day for 3 weeks. In another study, which also assesses meditation, we might then ask participants to do meditation for 3 times a week in 3 one-hour sessions for a period of 1 month. So that's a little bit more kind of ongoing there. Okay, so obviously it's the same simple IV, but the way we're measuring that simple IV is different across two separate studies. So that's why it's important for you to understand this concept of why researchers need to operationalize variables. If they don't operationalize variables, it's not specific enough. And I could say, oh yeah, these two studies both assessed meditation, but even so, they did that in very different ways, okay? They used different time periods. The participants were maybe less or more engaged in meditation in one study compared to another. So it's important to be able to be specific. A lot of the times, this might include putting a number to how long or how frequently that person is meditating. Okay. Same thing for sleep quality. So we might measure sleep quality in one study as being a self-report. So the participant describing how they felt once they woke up. In another study, we might measure sleep quality in terms of how much muscle movement the participant made while they were asleep. Okay, so we've got machines that measure how much muscle movement was actually made. So obviously we'll learn about that in chapter 9. Okay, when we talk about constructing research hypothesis for this one, it's again the same kind of formula. So you use the formula iPod, you start with those 4 words, it is hypothesize that. Insert your population, which in this case is year 10 students, who engage in insert your simple IV, which is meditation, insert your operationalizing, which is the first example from the previous slide, as measured by meditating for 30 minutes a day for 3 weeks. You can use any of those words, but you should always show a direction of effect, okay? That's what they call it. When we put a description, when we say, okay, this person will experience increased sleep quality, or this person will experience decreased sleep quality, using those descriptive words like increased and decreased is very important to show the direction of effect. You can't just say we'll have sleep quality. You need to say, is it going to be increased or is it going to be decreased? So you can use any of these words to demonstrate that. And in brackets, we are as measured by self-report of the sleeper's experience of an undisrupted continuous sleep compared to, so this is where I mentioned our control group, compared to year 10 students who did not engage in meditation. Okay, so again, the same format, you're just inserting those things into the formula there, and just that will help you to write out your research hypothesis. Okay, so now that we've talked about the research hypothesis, we have to understand the experimental group and control group. I know this should be quite straightforward to all of you by now. The experimental group is simply the group that is exposed to the IV. The control group is not exposed to the IV. The reason the control group is not exposed to the IV is because the control group needs to act as what we call a baseline for comparison, okay? Because they were not affected by the IV at all, when we do get the results out of the experimental group, we then compare them to, okay, how is academic performance with memory tips compared to those in the control group who did not have memory tips, okay? So the control group always acts as a baseline for comparison, which we use to compare the experimental group's results with, okay, to see if the IV did cause a change in the DV. Now, that's basically what the experimental and control group are about. Then we look at unwanted variables. So in a study, it's not always as simple as just having a nice IV, just having a nice DV, and the IV always causing some kind of change in the DV. Sometimes these unwanted variables come in, and these unwanted variables are basically variables that are not desired. We don't want them to be in the study, because what they can do is that they can kind of stuff up the reliability and the validity of our results. And we're going to learn about that probably in the next session. But the reliability and validity of the results is basically the extent to which we can confidently say, yes, the results of my study are due to the IV and not due to other random factors or extraneous or potential confounding variables. Now, if we link that to an example that we looked at before, like the study about how I take like 10 psychology students from our class and Miss B's class, and we run like an exam. But before the exam, I teach you guys memory tips or like mnemonic devices or that kind of stuff. So let's say I taught you guys mnemonic devices or memory tips and strategies, and then you go into the exam and wow, all 10 participants, all 10 psychology students have done amazing on the exam, okay? They've done really well. I can then go on to say that, yep, I'm confident that my IV, which was the memory tips, were the reason that my students did so well. But then can I really do that? Because number one, have I looked at individual participant differences? Maybe the participants that I chose for my study were naturally hardworking or were naturally quite good with memory or were, kind of like normally high achieving in the subject. If I've chosen those kinds of participants, I have invited unwanted potential confounding variables into my study, because now I cannot confidently say that it was my memory tips that helped the students. It might have been their own general knowledge. It might have been their own kind of level of competence in the subject. It might have been their own, their own memory strategies, or their own kind of natural kind of abilities there. Okay, so that's basically what we say when we say we don't want unwanted variables in our study, because once we get the results, we can't then identify, okay, were the results due to this factor or were they actually due to the IV, okay? As researchers, you always want, researchers always want their results to be mostly due to the IV and only due only due to potential confounding variables by a very small margin, okay? If you remember doing p-values last year and us having that magic number, which was less than 0.05, what that 0.05 actually signified was that 95% of the time, I want my results to be due to the IV. I will leave a little margin of error there for 5%. So only 5% of the time can my results actually be due to some external factor that I might not have been able to control, okay? So same thing, if I was getting my participants to do their exam and it was really noisy outside that day, they might have not been able to concentrate, even though they had the memory tips in them to do well on the exam. Okay, so there are a lot of variables that can kind of set in and confound your results. Confound means it makes it difficult for you to determine, was it the IV or was it some unwanted variable that has produced those results? Okay. Is everyone clear on the kind of extraneous and potential confounding variables, kind of like the basics of what I just went through now? And if you're not, you just unmute yourself, or you just put that question in the chat, okay? Because this is quite important. It is quite confusing as well. Yes, extraneous and potential confounding variables are similar. I will tell you the difference in the next slide now. So a lot of the time, extraneous and potential confounding variables, they are very similar. In fact, if you look at some resources online, some resources even kind of describe them as being interchangeable, like they're the same thing, but they're actually not, okay? So we do need to be able to differentiate between them. The easiest way to differentiate between them is using this memory tip called triple E or EEE. So extraneous variables start with the letter E. In most studies, extraneous variables are quite obvious, okay? If you guys are doing the exam, if I do a trial experiment before the actual exam, I'm like, okay, guys, I just want to set you up for the study. I'm going to give you a practice quiz. This isn't the actual study, but just a trial to see how we can run it. And while I'm doing that, and we're in 15R3 or 15R2, and there's all this construction happening outside, which always happens during our classes, and there's a lot of noise. And I'm like, you know what? This noise is not going to be good on the actual day of the study. I'm able to then identify that early in the study. I'm able to say, you know what? That noise is going to affect my students' concentration. It's going to affect their ability to do well on that exam. So because I've identified that early in the study, I might be able to, you know, book the multi-purpose hall out for that session where I run the exam. And so you guys can kind of do your exam in a more quiet place where noise doesn't act as an extraneous variable for your performance on that exam, okay? So extraneous variables, most of the time, they're identified early in the study. That's the first E. The second E is because they're identified early in the study, they are eradicated before. Eradicated means that they're eliminated, okay? They're eliminated before they can have a major impact on the DV. And a lot of the time, extraneous variables are environmental variables. So we're talking about things like noise. We're talking about things like the level of lighting, okay? Let's say one of the lights go off in our class while we're trying to do the exam, and it's like super dark because it's a super cold and gloomy day. You guys might not have enough light to actually be able to properly read the scenarios on the exam, okay? That could actually legitimately be an extraneous variable. So as much as humanly possible, as a researcher, I or any researcher needs to be able to, identify these extraneous variables early in the study. So that's what an extraneous variable is. They're usually identified early in the study. They're usually environmental variables like noise, light, sound, all that stuff. And they're usually eliminated or eradicated before they can have a major impact on the DV. This doesn't always mean, though, that they are always eradicated. So you can still have studies where noise actually does end up affecting the results because the researcher didn't notice that that was a big issue, or they didn't think that it would affect the participants as much as it did, okay? Now, Coming to the next one, which is potential confounding variables. Potential confounding variables are the ones that slip through. These are the unwanted variables that the researcher, for some reason or the other, doesn't identify early in the study, and thus they don't think about controlling them or eliminating these variables. These are called potential confounding variables because if these do slip through unnoticed and away from the attention of the researcher, they have the potential to actually confound your results in a very big way or in a very profound way, okay? And they do have the potential to even take over the effect of the IV, okay? That's why we call them confounding variables, because they essentially confound the IV. Confound means they make it difficult to determine whether the results were due to the IV or due to some other unwanted variable. Okay, so a confounded DV is very annoying, okay? It's a very annoying thing to have because a confounded DV means that your results are confounded. You can't confidently say that, yep, my results were due to the IV. And for that reason, if you're a researcher who's put all this effort into your study, into running this study, and you really want to publish your paper on it, no, you can't do that because you can't confidently say that your DV was mostly due to the IV rather than due to some other unwanted variable. Okay, does that make sense about the difference between extraneous and potential confounding variables? Extraneous variables most of the time are kind of identified early in the experiment. They are kind of controlled for. Potential confounding variables are the ones that slip through, okay? They're the ones that usually go on to have a more significant impact in terms of actually confounding the DV or confounding the results or making the results less reliable. Okay. Yes. So if the external variables or if the extraneous variables are identified later on in the study and not earlier, we can still call them extraneous variables, okay? Because again, in terms of the actual impact, so if I'm talking about an extraneous variable that we haven't controlled for, compared to a potential confounding variable that we haven't controlled for, both these variables will still have the same impact on the DV. They will still go on to confound the results. So yes, we can still call them extraneous variables, okay? And we've, as I'm going to go through in a bit, there are specific names that we have for the specific potential confounding variables you need to know according to your VCAR study design, okay? They've got specific names like individual participant differences, order effects. There are specific ones we need to know. And everything that doesn't fall into one of those categories, so things like noise, light, they will always be called extraneous variables, regardless of whether controlled or not controlled for them at the beginning.
And Miss, can you give some examples for confounding variables?
Yes. So basically for confounding, yeah. So we're talking about things like individual participant differences. So like I said before, if I've got really high achieving or really people that are really good with memory or someone who's just done 5 trial exams before my actual study where I'm assessing exam performance, those kids might do better simply because they had better practice or simply because they work harder in the subject as compared to me just giving them memory tips on mnemonic devices. Does that make sense? We've also got like other potential confounding variables like order effects. Order effects are something we see mainly in repeated measure design studies. We've also got things like non-standardized instructions and procedures. So let's say if me and Miss B were running the experiment and I was giving a set of instructions to you guys and she was giving a set of instructions to her class, if she was giving her instructions in a really clear way, really giving all the details, and in comparison to that, if I'm giving my details or instructions in a really rude way and being like, oh my God, okay, whatever guys, just do this. You know what? I'm not even, I don't have time. I have to go, I don't know, have my lunch or something like that. That's not the same. We're not giving the instructions in the same way. So that's actually called non-standardized instructions and procedures. And there are some other ones as well that we're going to go through. But generally they're specific ones. And another question, if you want to remove an extraneous variable. Yes, in terms of a definition, if we can't remove an extraneous variable, like if the light shuts down and the students are still continuing to do the exam in very poor lighting conditions, then because that extraneous variable has slipped through, it doesn't really become a potential confounding variable, but it has the same effect as a potential confounding variable. So in terms of a name, we'll still call it an extraneous variable, but we will say that it has gone on to confound the results in the same way that a potentially confounding variable would have. Okay? But name-wise, we would still define or name it as an extraneous variable. Okay, so we're almost done for today. I will try to go until 12 o'clock today though, because we did start a little bit late. I'll just basically finish off with the potential confounding variables, and then we're basically done for today. Okay, so like I said before, these are the specific extraneous and potential confounding variables listed in the study design. Sorry, I shouldn't write extraneous there. It should just be the specific potential confounding variables. So these are the only ones you need to know according to the study design. If in a question you are asked to identify a potential confounding variable in the study, more often than not, they will expect you to name one of these. And more often than not, these will be present in the scenario that they've written up. So the first one I've talked about, individual participant differences, order effects, placebo effect, which you might have heard of, experimenter effect, and non-standardized instructions and procedures, okay? Now, we're not only going to learn about these, but we are also going to learn about how we can control for them or how we can minimize their effect. Because it's not just important for us to know what they are, but also know from a researcher point of view how researchers or experimenters can control for these particular types of potential confounding variables. Okay. And yeah, so the first one is individual participant differences. So the first potential confounding variable that we're going through is individual participant differences. So these are basically differences in participants in terms of any variable. And if this variable or this characteristic of that participant actually goes on to affect the results, then yes, we can say that that has potentially confounded our results. So let's say we're doing a study and the researcher is asking you know, different questions of different people. It might be a question about, you know, experiences of stress. Okay, experiences of stress during BCE. Okay, so if the researcher is asking all these participants, we have to remember that not all participants are carbon copies of one another. Every participant comes into a study and they've got different personalities that they bring to the table. They've got different kind of, you know, they've got different ways of kind of speaking or different ways of dealing or communicating with others. So one person might be super enthusiastic to talk about all the experiences of stress that they had in their life. Another person might be like, this girl looks a little bit anxious. This guy has a bit of an attitude. This guy seems a bit clueless. So again, like it really depends on what kind of individual characteristics you bring to the study. Okay, a lot of the time, if we're talking about something like exam performance, okay, the effect of memory tips on exam performance, something like intelligence or capacity in the subject could play a role. If we're talking about something like your ability, yeah, this is going to be super cliche and super stereotypical. If we're talking about something like your ability to play certain sports, okay, height might have an advantage there. If we're talking about your ability to, you know, if we're talking about your ability to engage in physical activity, your original physical fitness level will play a role there. Okay, if we're talking about something like, you know, what's it called? If we're talking about like the effect of alcohol on driving ability, and we're going to do a study about that as well in chapter 9, driving ability, your general driving ability to begin with could be a potential confounding variable. Okay, so any of these particular individual characteristic, these are just a few examples. There's so many you can think of depending on the study. These will actually go in to actually have an effect on the DV. Okay, and because individual participant differences can give participants either an advantage or a disadvantage in the study, it then becomes difficult for us to determine confidently that the IV was due to the, that the DV was due to the actual IV, or that it wasn't due to their own ability. So it becomes a little bit difficult for us, and the DV does become confounded. So how are we going to control for individual participant differences? It's quite easy to control for individual participant differences. The first thing you can do is use a repeated measures design, which we're going to learn about probably in the next session. Repeated measures design basically use the same participant for both the experimental condition and control condition. So if you were to have 10 participants in the independent groups design, we can actually turn that into only 5 participants in the repeated measures design, because essentially with repeated measures, we are using the same participant. We are using the same participant twice. Okay, once in the experimental condition, once in the control condition. Another thing that we can do is we can have a really large sample size. So a general rule is the larger you make your sample size, or the larger you make the number of participants in your study, the more the individual differences will get balanced out. Balanced out means that because you've got more participants, the actual individual impact is going to be less in relation to the actual large sample you've got. And when we're talking about large samples, we're talking about like huge numbers of participants. We're talking about like tens of thousands, hundreds of thousands, okay? Like population-based studies. If I'm doing a study on people in Australia, if I'm doing a study on a certain suburb or city. Okay, so again, it's a bit hard for a general researcher like you or me or someone that's in a university to have access to large samples. So similarly, another thing we can do that's a little bit more easier is we might be able to use a matched participant design. In a matched participant design, we're basically taking one participant, so Miss Farween, and we're finding someone very similar to Miss Farween in the population, and we're matching them together, okay? And so Miss Farween might go through the experimental group, whereas Miss Farween's clone or twin might go through the control group, okay? So it's basically not the same participant going through both conditions, but basically the kind of like one version of that person going through the experimental condition, and their pair or the person that's similar to them that was found in the population going through the control condition. So those are some things that we can do to have a control or a minimization of the effect of individual participant differences. Okay, the next one is called use of use of non-standardized instructions and procedures. So like I said before, this is basically related to the way that your researchers are giving the instructions or procedures, and this is mainly to do with how the researcher treats the participants as well. So let's say I gave you a previous example of me and Miss B giving the instructions to two separate classes, but it doesn't always have to be two different researchers. I could just be the only researcher in my study. But when I go to the students in Miss B's class, maybe I'm giving the instructions to them in a little bit more detail. Maybe I'm being a little bit more nicer to them. Whereas when I come back to you guys, I'm just like, oh, you know what? You guys know me. Like, you know what I want from you. You know what's expected. So just get on with it. That's not fair because I'm giving Miss B's class more instructions, whereas I'm not giving you guys the same instructions, or I'm not giving those instructions to you in the same tone. Okay, or maybe by the time I give the instructions to Miss B's class and come to you guys, I'm super tired, so I don't have the same manner, or I don't have the same enthusiasm that I'm giving those instructions with. Okay, so you guys might be slightly disadvantaged by that, or you might decide you don't want to perform as well or give as much attention to my study because you're like, you know what, Miss Farween doesn't even seem serious about her study. Why should I give a damn about what she's doing? Okay, or why should I put in any effort into her study? So basically, that's what we're talking about when we're talking about non-standardized instructions and procedures, that when you're a researcher, the way that you give instructions, the way that you talk about procedures or talk about the study to your participants has to be standardized. There has to be a specific standard, and you have to be delivering the instructions to that specific standard. Okay, and if you don't, then the participants might decide they either don't want to do the study according to how you want it, or maybe they want to do better because they're like, oh my God, she was so nice when she gave the instructions to us. Let's try to do this and, you know, make her feel happy with our performance or something like that. Okay, so that's the use of non-standardized instructions and procedures. How can we control for this? Simple. We just make sure that we discuss a standard that, okay, everyone, this is the script. No extra discussions outside of the script of instructions. You're going to go to this class and read this instruction to them in this specific manner. No happy tones, no nice voice, just in a neutral way. Okay, and experimenter number 2, you go to this class and you do it in exactly the same way. That's the most basic way we can control for this potential confounding variable. Order effects are simply only seen in repeated measures design, so just make sure you remember that. We don't see order effects in other research designs. So order effects are basically only seen in repeated measures designs, and we're basically going through the same conditions again and again in the same order. So remember, when we're doing a repeated measures design, if I'm participant 1, I will go through condition A and then condition B. And then eventually I will be asked to repeat these again, just for reliability purposes. What order effects do is that when I go through the same conditions again and again, going through them in that same order, condition A first, condition B, then condition A, then condition B, it kind of gets a little bit boring. Okay, and basically what that can then lead to is either boredom, or it can actually lead to someone getting better in terms of their performance. So essentially what we're trying to do here is we're trying to change the order of the tasks that the participants do. So we're mixing it up for them a little bit more. So they're not always doing the same kind of boring and dreary tasks A, then task B, then task A in the same order. We're kind of mixing up the order of the tasks. So that number one, they don't get bored, and number two, they don't get better at doing that task. Okay, we know that saying practice makes perfect. We don't want practice makes perfect to actually be the reason for the participants' performance in a study. We want to make sure that they are actually, performing because of the IV and not performing because of the order effect itself. Okay, so how do we combat order effects? We combat order effect using a procedure called counterbalancing. So essentially what we're doing in counterbalancing is we are mixing up the order of tasks. And so mixing up is basically saying that we're varying the order of tasks. Okay, so rather than participant one always going through task A and then task B, we might make them go through task A and then B, and then make them go through task B and then A. So we're kind of reversing it and mixing it up each time. Okay, so this is obviously a poorly studied topic, but you do need to be able to remember that order effects only occur in repeated measures design. So if you do get a scenario and it's clearly an independent groups design and it asks you to identify a potential confounding variable, you will not write order effect because that study did not use a repeated measures design. Okay, so remember, order effects only are relevant to studies that use repeated measures designs. If not, they're completely irrelevant and you don't even need to worry about them. Okay. All right. It's already 12 o'clock, so I think I'm just gonna kind of stop. Actually, you know what? It's just 2 more slides. I'll just give me another 5 minutes and I'll be done. Okay, so experimental effect is talking about the expectations of the experimental or researcher. So again, sometimes a researcher, because they're so kind of hell-bent on making sure that their research goes the way they want it to, sometimes they will, sometimes they will place expectations on the group. So they might be like, if we're studying the effect of consuming green tea on weight loss, okay, there's a common perception that if you drink green tea, it'll be good for weight loss. If a researcher is doing that and they make them the green tea and they give it to them, and they're like, you know what, this green tea is really supposed to help you lose weight. In fact, I know a lot of people who lost weight from drinking this green tea. What you're doing then as the experimenter then is you are placing your expectations of what you think the green tea will do on the participants. So then when the participants drink the green tea, they might then lie that, oh yeah, experimenter, you were right, I lost like 2 kilos from drinking the green tea. When actually maybe they didn't lose anything, or maybe it didn't have any effect. Okay, so experimental effect is basically the researcher places expectations on a group and kind of gives them a hint as to how the IV might affect them. Okay, and we always don't want that to happen because we never want to come to the end of a study and basically think about the fact that, okay, were the results due to the IV or were they due to the expectations that I put on my participants? Now, how do we control for minimize the effect of the experimenter effect? We use the double-blind procedure. Double-blind procedure, as you can see in this diagram here, in this picture, double-blind procedure is when the experimenter doesn't know who's getting the IV and the patients don't know who's getting the IV. So the patient doesn't know if they're in the experimental group or if they're in the control group. And if these patients don't know who is getting the treatment, they're not going to be able to basically act accordingly, or they're not going to be able to act in accordance with the expectations. And obviously, if the researcher doesn't know who's getting the actual green tea in this case, he won't be able to place his expectations because he doesn't know who's the experimental group to begin with. Okay, so basically a double-blind procedure is when the experimenter and the participants are both blind as to who is getting the experimental treatment or who's getting the IV. Okay, this can help because it can stop the experimenter from knowing who is the experimental group and who's the control group, so he can't place his expectations on them. Okay, the last topic we're going through for today, and then I promise I'll stop, is the placebo effect. So we all know what the placebo effect is. It's when the participants place their own expectations. So in the experimental effect, we talk about the experimenter placing expectations on the participants as to how they might behave or react to the IV. Placebo effect is when the participants themselves place those expectations as to how they will react or respond to the IV. So if I give, if you're the researcher and you're giving the participants green tea, and you don't tell them anything, you just give them the green tea. But then the participants are kind of like, you know what, I always read in these articles that green tea helps you lose weight. So maybe I should tell the researcher that I lost weight. So maybe he'll be impressed by my progress. Okay. If you do that, then that basically means that we've got a placebo effect. Placebo effect, the own participants' expectations of how the IV will affect them has an unwanted effect on the results. So how do we minimize for the effect of the placebo effect? Basically what we do is we don't tell the participants which group they're in. So if the participant doesn't know whether they're getting the IV or whether they're getting a placebo, they're not going to be able to place those expectations on themselves that, hey, I have to react accordingly to this, or hey, I have to react because this is the IV that I've been given. Okay, so obviously not telling the participants whether they're in the experimental group or the control group, and thus them not knowing whether they're getting the IV or whether they're just getting a placebo, will help us to eliminate the placebo effect. All right, so I'm just going to stop there and wait, just want to see the next one. Okay, I'm going to stop there. Now, are there any questions that you guys have about anything we've covered so far today?
No.
No?
Miss,
Yes.
did you talk about counterbalancing for order effects?
Yes, I did.
Can you repeat that?
Yes, I will. Counterbalancing is basically, you know how in order effects, people's performance gets affected because they get either bored of the same order of conditions, or they get better at it through practice. Basically what we're doing in counterbalancing is, rather than giving them the same order of tasks, we're mixing up the order of tasks. So rather than giving them tasks in the order of A, B, C, D, we might give it to them A, B, C, D in the first trial, but in the second trial, we might go D, B, A, C. Or in the third trial, we might go C, B, A, D. So you know what I mean? We're mixing up the order of the tasks, so they'll get less tired of doing the same tasks in the same conditions or the same order each time.
Okay.
Yeah.
So if they don't do the same things in order again.
Yes, exactly. We mix up the order of the tasks.
Yeah, and that's to get rid of boredom, right?
Exactly, yep.
Okay.
Alrighty, so that's basically it for today. Let me just see, a few more questions coming up. Oh yes, I will have to talk about the SAC, and do we make up the numbers when we are operationalizing? Do you feel, does the question tell us? No, the question will always tell you the numbers. Okay, so when you get a scenario-based question and you're asked to talk about the operationalized IV or DV, the question itself will always have the numbers in it. You don't have to make up numbers ever. Okay. Alrighty. Okay, yeah, about our SAC. So as you might have heard yesterday, the Premier made the announcement that school will begin on, I think, the 26th of May for year 11s and 12s. Obviously, whoops, I'll just stop the recording first.